You know, your eyes are how you see the world, right? But what can a doctor see when they look into your eyes? Today, we're basically going to be detectives. The clues? Well, they're hidden in plain sight. We're going to investigate how the eye can spill secrets about diseases happening elsewhere in the body. So, let's crack the case.
Okay, so the eye, it's not just a camera. It's so much more than that. Think of it more like a live feed from your body's entire internal network. I mean, it is just packed with exposed blood vessels and nerves and tissues that are all directly connected to everything else. So when something's wrong somewhere else in your body, the eye is often the very first place the evidence shows up.
So yeah, what if your eyes could actually talk? What kind of secrets would they tell about your overall health? Well, we are about to find out. We've got 2 real-life medical case files to crack where the eye revealed everything.
All right, let's dive into our first case, the painful red eye. Now on the surface, this one seems pretty straightforward, doesn't it? But as we're about to see, the initial symptoms are hiding a much bigger story.
So here are the facts. We've got a 25-year-old man. He presents with a sudden onset of symptoms in one eye. We're talking intense pain, severe redness, and blurry vision. I mean, these are classic alarm bells ringing. To figure out what's really going on here, we need to get our magnifying glass out and look at the evidence inside the eye itself.
Okay, our first clue. Investigators find something called chorotic precipitates, and honestly, the name is pretty descriptive. They're these tiny clumps of inflammatory cells that have literally settled on the inner surface of the cornea. You can think of it like finding a fine dusting of biological evidence at a crime scene.
The second clue is something called an anterior chamber flare. Now this happens when inflammation makes the blood vessels leaky and they start to spill protein into the fluid at the front of the eye. For the person examining it, it creates this hazy, cloudy view, kind of like trying to see through headlights in a thick fog. And this is an absolutely critical piece of evidence. It proves the inflammation isn't just on the surface. No, this is deep inside the eye.
So, with our evidence collected, those chorotic precipitates and that anterior chamber flare, it is time to line up the usual suspects. I mean, based on a painful red eye alone, it could be any one of these conditions. Our job now is to see whose story actually holds up. Let's check their alibis. Conjunctivitis? Nah, that typically involves discharge, but not that deep inflammation that we're seeing. Scleritis and glaucoma? Their stories just don't line up with our specific evidence either. And what about retinal detachment? Well, that presents with flashes and floaters, a totally different signature. So it seems each of our initial suspects has an alibi.
But then, the final piece of the puzzle falls right into place. It's in the patient's medical history. He has ankylosing spondylitis. Now, this is a form of inflammatory arthritis that primarily affects the spine. And this is the critical part. It has a known accomplice.
And there it is, the diagnosis, acute anterior uveitis. Uveitis is just a word that means inflammation of the middle layer of the eye. So, you see, this was never an isolated eye infection. No way. It was a direct complication of his systemic autoimmune disease. Case closed. The eye wasn't the source of the problem at all. It was shouting a warning about a problem rooted in the patient's entire immune system.
Let's open our second case file. This mystery is different. The defining feature isn't some painful red flag, but a chilling, sudden darkness.
Our second subject, a 50-year-old man. He wakes up one morning and the vision in one of his eyes is just gone. No pain, no redness, no warning whatsoever, just a sudden blackout. The cause of this silent thief of sight is hidden deep inside the eye. Now, before we even examine the eye, the patient's history gives us 2 huge clues. He has high blood pressure and he has high cholesterol. Remember these 2 things. They are pretty much the motives for the crime we're about to witness. So when doctors look at the back of his eye, the retina, they see a scene so dramatic it has its own clinical nickname, a blood and thunder fundus. It sounds intense because, well, it is. But what does that actually look like? It looks like this. The entire retina is covered in these flame-shaped hemorrhages. That's the blood. Then you've got these cotton wool spots, which are these fluffy white patches that tell you there's nerve damage from a lack of oxygen. And the veins themselves are twisted and swollen. That's the funder. It's a crystal clear picture of a catastrophic plumbing failure. So how did this happen? It's a chain reaction, really. Years of high blood pressure, our first risk factor, remember? It weakened the blood vessel walls. Eventually, this led to a blockage and occlusion in the main vein that drains blood from the retina. So with the primary drain pipe clogged, the pressure became immense.
Blood and fluid had nowhere to go, so they backed up and just leaked all over the delicate retinal tissue. And that's what caused the sudden, painless blackout.
That's really important not to confuse this with its close cousin, a central retinal artery occlusion. A vein occlusion, our culprit, is a plumbing backup, creating that messy blood and thunder scene. An artery occlusion, on the other hand, is a blockage of supply, which starves the retina of blood. This creates a pale retina with a single, famous, cherry red spot. Two very different mechanisms leading to two very different crime scenes.
And the final diagnosis, central retinal vein occlusion, or CRVO. Are you noticing the pattern here? Just like our first case, this wasn't really an eye problem at its core. It was a vascular problem, a direct consequence of years of high blood pressure that just happened to declare itself in the delicate blood vessels of the eye.
So, after cracking two very different cases, what is the big takeaway? What have we learned from using the eye as our magnifying glass?
I mean, think about it. In just two cases, a close look at the eye revealed two completely different systemic problems: an autoimmune disease attacking the body, and a cardiovascular system under some really dangerous strain. In both of these mysteries, the eye was the lead informant.
And here is the key takeaway. Your eyes are not just for seeing out, they are for seeing in. They are a built-in early warning system that can signal trouble long before it shows up anywhere else. So paying attention to your eye health is paying attention to your overall health.
And that really just leaves us with one final question, doesn't it? We use the eyes to solve these two mysteries, but they are just one part of the story. What other subtle clues are your body giving you right now that you might be missing? What else is it trying to tell you?